Hello there, always a pleasure to have you join us here on the Big Q. With me, Imi Mulekatete Kalema. And like promised last week, today we go health. And joining me in the studios is the Minister of Health, Dr. Agnes Binagwaho. Great to have you on the Big Q.
It's my big pleasure to be with you.
Now, before we indulge in some of the questions that were sent by the audience on our social media platforms, please give us a brief of some of the approaches and strategies that have been adopted in the ministry to improve or better the health system in Rwanda.
We have worked hard to give a geographic equity by having one health center per sector. Out of the 416 sectors in Rwanda, remain only 8 without a health centers. But around those sectors, we have 2, 3, or 4 other health centers. But each sector will have them. We managed to have a district hospital in each district, more than one in some districts. We have one provincial hospital in each province, and we have one referral in each region of the country. Okay. So geographic equity for the people to have access in the same way across the country. The other thing is the participation of the citizen. Okay. You know that we have 45,000 community health workers. They are elected by their peers in the village, and the Minister of Health have to educate them. So participation, geographic equity, financial equity, because by the government is not the Minister of Health alone. Mm-hmm. The government has has helped creating the Mutuelle de Santé. Yeah. Mutuelle de Santé give you access to basic care and some specialized care across the country. Also gender equity. Yeah. You know, in 2000 there was a study done by ONAPO at that time, okay, showing that women have less access to care than men. Okay. Now it's no longer the case. And also by setting up pediatrics care across the country, vaccination across the country, gender is also respected. I think it's a good start. We still have a long way to go, sure, but it's a good start. Very
good. Now, over to Austin Kaitana. Many patients die on their way before reaching the referral hospital, all blamed on poor management of Department of Doctors. Are you aware of such delays and refusals to transfer patients in life-threatening situations?
No. I think that many patients reach hospitals a little bit late. Okay. Sometimes too late. And this is why we need to make a lot of effort for prevention, for awareness. And that's why also we count a lot on the press to help us in that way. You know that we have a lack of doctors. We produce only 100, less than 100 a year. And we don't have enough specialists as well. We don't have specialists in all the area. And we have made a big effort the last 3 years to educate doctors in specialties. So that means for the time being, we take for specialties the same number of doctors that what we produce. When those will come in at workplace, Rwandan will be better served. But there's these 4 years, 5 years, where we'll have difficulties.
Over to Pierre Habineza. Why can't the prevention of hepatitis B and C be charged on Mutuelle de Santé, since the biggest nationals can't afford private treatment?
It's a specialized care. I just want to say that we just finished negotiation with Gilead, the pharmaceutical plant who produce the new drugs. You know, previously, the treatment that was there had only 10% success and was costing 10 million Rwandan francs. Now we have a new regimen of drugs that give 95% of success. And the cost was $80,000 for a cure. Okay. We have managed to reduce it to around 2,000. So this is the way we have helped our citizens to get access to the treatment. But Mutuelle de Santé cannot provide all the care, all the specialized care for 3,000 per capita. So what we can do is to continue to negotiate to reduce the price. So the more we will grow, the better the health of our citizens will be. And also, the more people pay their taxes without tricking, the better the overall country will be.
Okay, now looking at probably some of the figures or statistics on Mutuelle de Santé, how come we have very few numbers or Rwandans that are participating or that are part of the contribution of the community health insurance scheme? Why don't we have bigger numbers?
You know, we have 82% of our citizens that are on health insurance on voluntary basis. I think it's the highest on earth.
Actually,
no, wait a minute.
Yes.
Let me answer.
Yes. Okay.
We have 6% with Rama, MMI, private, and others. Yeah. And the rest come from the health insurance. We have 18% of people who didn't contribute. So this is not the majority of people who are not on Mutuelle de Santé. But this contribution, it's 7 billion. So it counts. So that's why it's an appeal for everybody to contribute, because the system of Mutuelle de Santé can work only if everybody pay his part.
You talked about some of our own Rwandans who have probably been sent abroad or that are acquiring specialized medical, skills. Now, Cash comes in with the questions. There are many cases of medical students who go abroad on government sponsorship and never come back. How does government account for such investments?
In the health sector is not the case. Okay. In the health sector, the majority are coming back. Those who seem not to come back, they are doing surgery, and when they are there, they like what they do. They want to do subspecialties, like we have now 6 who have just required that. Because we need those subspecialties as well, we give them authorization. Very good. When I told you we have 263, I really follow the numbers month after month, and the name as well. We know when they have to come back. Some of them, of course, for the reason either they have been sick or they have been had other problem, miss a year and have to prolong. But it's even not the majority.
Now, over to Butera, most of the hospitals have quality facilities or equipment. Do they have the qualified doctors to operate them? Yes or no? Do we have?
No. We for what we buy, we can use them, but not at full potential because we don't have enough specialists. That's why I told you that currently we have made a big effort the last 4 years to produce more specialists and subspecialists, but we don't have enough. Another reason why we don't have enough, we don't produce enough doctors. Hopefully, we hope that in the next 2 years we'll have 3 new universities with a faculty of medicine. So it takes 6 years to educate a doctor, but I guess that in the next decade we'll produce more doctors, probably enough doctors for the population.
Very good. Now, in 2013, the government of Rwanda made a massive loss of 2 billion Rwandan francs, and that is after King Faisal had bought a bulk of medicine and it expired in store. This does it for this day, and let's meet next week for part 2, still on the BQ. Be well and be blessed.